what skills make a good trauma surgeon? And people ask me this all the time. So trauma surgery a lot of times is much easier than very complex general surgery. And I'll give you a perfect example. So I have a young patient involved in a motor vehicle crash, and they tear their sigmoid colon, okay? So they require a damage control sigmoidectomy, and they've never had previous surgery before. They're just a young trauma patient, unlucky, involved in a car accident. Versus, I have a patient who comes into the hospital with perforated diverticulitis that's recurrent, has had previous multiple other surgeries, or has a large obstructing sigmoid colon mass that's completely plastered to the retroperitoneum in the side wall of the left lower quadrant of the abdomen, with the ureter just integrated into that entire mass. So I think you get my point here. You being a really good general surgeon and taking on extremely complex general surgery disasters is what makes you really good at the trauma surgery disasters, because there you're moving fast and you're making critical decisions quickly, and those decisions are easier to make because you've seen the other side of that, where you're in a completely frozen abdomen with a complex cancer or complex inflammatory pathology with adhesions everywhere. And so again, taking on really difficult acute care or complex general surgery is what makes you a really good trauma surgeon. And then the critical care aspect is being a good medical critical care doctor is what makes you really good in surgical critical care, and then managing burns, this complex surgical patients, and trauma patients. So I think that's important for people to know. So I always tell residents, like, you got to first become a really outstanding general surgeon, and that will then make you a good trauma surgeon.